So I wanted to take just a minute to, like Michelle said, to talk through the collaborative performance updates for the year. A lot of this is kind of looking back at 2021 with a little bit of look forward to 2022. So this is a slide that we've traditionally shown every meeting. I think we always go a little bit back and forth within the coordinating center trying to figure out whether this is actually of value or not. I think the hard part with looking at this slide is that when you look at, say, 2017 adult minor head injury appropriateness compared to 2021, that's not really an apples to apples comparison, because the hospitals, similar to the cohorts that Michelle just showed you, the hospitals that were in 2017, some of them are still in, some of them are not, and there are a lot more in 2021. So, it's not exactly a linear growth between the years. But I think it is important to just show like where we are at each year. So I'll dive into the details on most of these in a little bit more depth in a minute here. But on this slide, I did at least want to call out two of these that I feel like are a little bit more relevant in this slide. So I'll start with the adult low risk chest pain. So we have shown improvement from 2020 to 2021. These are mostly the same hospitals. There's a little bit of a difference, but it's a pretty fair comparison. So, this is in some of the impact stuff that we've sent out lately, but I think that, going from 89.6 to 92.1, it's only a 2.5% increase, but that's a pretty significant difference in the amount of actual, patients who were not admitted, who were sent home with low risk chest pain, and there's significant, obviously, impact to the patient and savings in that too. And the other one, just to call out, was the pediatric asthma discharge one. I think this is a tough one that we struggle with a little bit, in that it's hard to know exactly if 2020 is a fair baseline year on this measure. As we all know, ED visits were down significantly in 2020, especially for kids. So, as we go forward, I don't love that 2021 had a lower discharge rate than 2020, but it's not clear that 2020 is a fair baseline. So we'll keep an eye on that going forward and just kind of take a look at that as it goes. Okay, so in a little bit more detail on the adult minor head injury, there's a lot here. Obviously, I'm not going to try to read it all, but I think that the takeaway here is that steady improvement. If you break out each cohort who, roughly have been working on this for the same amount of time, we see steady year-to-year improvement. And, sites come in at different places. Some sites have done this kind of work before, and some are totally fresh to it. So it's reasonable that the cohorts don't all start at the same place. But I think what's really encouraging is to see that every year we continue to get better. Same story basically with pediatric minor head injury. This is the intermediate risk utilization. Nice decreases year over year. And I think it's really cool to see, for the most part, that when you go from that year 1 to year 2 with most cohorts, they see a nice improvement. PE is kind of another interesting one. So Keith is going to go into this in a lot more detail. Dr. Barnes is going to be on to talk about PE and COVID in general. I think this was following a really nice trend, a very similar trend to everything else going into 2020. But as has been brought to our attention a lot by pretty much everyone, that, there's questions about how COVID interacts with PE diagnostic yield. So 2021, we did see, for the most part, worse performance. But again, Keith will go into that, and there's probably more to that to look at with that one. Another encouraging story on the pediatric respiratory illness, chest X-ray utilization. Michelle will have some more information on this, but again, pretty good, consistent general trends. Lower is better in this, so everyone is getting better as the years go on. Okay, so one thing that we did want to circle back to is that we called 2021, especially with all the concerns about chest X-ray and PE and COVID, we did an all-in for head injury campaign in 2021. We really felt like this was a initiative that should be less affected by COVID and really would give us an opportunity to really dive in on it. And it's exciting to see that it worked. It worked really well, actually. And that, we made a big investment on it. We kind of rolled the dice and crossed our fingers that it would work. And it really made a big difference. So from 2020 to 2021, we saw almost a 4% increase in appropriateness for CTs and adult head injury, which equates to about 650 avoided inappropriate scans and, close to $850,000 savings estimated, of course. So we're really excited that, we put a lot of points on it, we worked on it, and it seemed to work, and that's great. So Similar story for the children too. So went from 20% utilization down to 17.6 utilization in 2021. The volumes are just lower here, so the impact is going to be less. But again, 91 avoided scans, $120,000. So, I don't know that I'm the best to kind of get people excited about this, but I think this is something that internally in the coordinating center we are really excited about. It was a big push of 2021, and it really looks like this made a difference, and we did show significant improvement. So that's really exciting for us. So then just, to look a little bit more carefully on this, I think a couple things I wanted to call out that, we do hear sometimes, and we wonder for the sites, cohort 1 sites. So these are sites that have been working on this stuff since 2017. Like, is there a plateau? Is there any more juice to squeeze? Is it time to move on? And it was really exciting to see that for that cohort that's been with us the longest, we had a really nice big increase in appropriateness in adult head injury from 2020 to 2021, where, if you look for 19 into 20, it kind of looked like we were going to have a little bit of a plateau and maybe we were leveling out. But this investment in that really did seem to push that number up even higher. And similar in cohort 2, haven't been with us for quite as long, but again, looked like a little plateau between 19 and 20, and then a nice big jump into 2021. On the pediatric side, similar story. This is one where, 2020 with kids, I think there's a lot of caveats there, but it was exciting to see that 2021 was an improvement over 2020. And again, same cohort 2. So I think the take-home message with this, two things. One, it's nice to see that sites that have been working on this stuff for a long time still have opportunity for improvement, and they were actually able to realize that improvement. And two, I think we kind of selfishly wanted to use some of the graphics that are available to you on the Tableau Medic Registry to show how you can pull some of this information, or what kind of information can be pulled. Okay. So all that together, we are excited to, everyone should have gotten their P4P scorecards by now, but we met our collaborative wide measures for P4P. So, I think that we in the coordinating center and the executive committee, when we made the decision to put most of our performance points on head injury in 2021, like I said, we kind of crossed our fingers and hoped that would work out, and we're excited to see that it did. So for all year 2 sites, 20 out of your 30 performance points in 2021 were on head injury measures, and in your 3+ sites, 30 out of your 70 points. So we met those measures, kind of crushed them in both instances. So that resulted in really nice scores. And I think this was kind of interesting to me too, in that looking at, this is the 2021 P4P year over the course of the year. As we got invested in this work, it looks like, the really strong performance came later in the year. So, it's hard to exactly always call causality, but it's exciting to see that as the year went on, we got better. Not quite as clear of a story on the pediatric head injury, but again, from the first half of the year to the second half of the year, we showed the improvement, and we made it all the way through and met the target, which was exciting. Okay, so this is a slide that we've started showing every year, just to show where sites ended up on their P4P score. So wanted to flash back to 2020, and we had a pretty wide distribution of scores, with the average score being 84. Forward to 2021, you can see, as I said, like when we made the decision to put so much of the weight on the collaborative wide head injury, this could have gone 2 ways. This could have looked like this, or it could have looked, really bad, shifted off to the left. So we are excited to see that, the average score went up from 84 to 94. Several sites got 100. Our lowest score was just 1 point less than the average from the year before. So I'm excited. I think we're excited that, this could have been down in the 50s and 60s had we not met those collaborative wide measures, but we met the measures, and everyone got a really nice score for 2021. And congratulations, obviously. Okay, shifting over to VBR for 2021. So if you remember on the individual physician VBR, this was something that we kind of jumped into late. It was an opportunity presented to us right about this time last year, to allow an additional 2% fee schedule increase for individual physicians on VBR. And if you remember, this is where you had to register for an account, fill out a couple surveys, and commit to an improvement plan as an individual to get this 2% increase, or 2% fee schedule increase. So we are excited that 351 physicians at Medic at 18 sites did the work, qualified, and are now eligible for this 2% increase. So I don't know that we knew exactly what that number would be, but I think 351 is a really exciting number. And this, by definition, these 351 people all have access to their data on the medic registry, or have an account to actually look at it. So that was exciting to us, and I would say that's at least a order of magnitude increase from the engagement that we had on the prior platform. So having 350 physicians actively looking at their numbers is really exciting for us. Going into 2022, we have a similar thing again, and this, as I kind of click through these steps, I'll just put them all up here. This is similar to how we do P4P, where when you first start, it's all participation. You don't have to actually meet a performance target. And now moving into 2022, in order to get this incentive, individuals will have to actually meet a performance target. So I talked about this in the October collaborative meeting. We've sent a lot of emails, but I want to take every opportunity I can to say that it's not too late as an individual physician to qualify for this fee schedule increase. You need to register for an account on the Medic Tableau server. If you did it last year, you're good. You don't have to do it again. Just one account. In the second half of the year, so between May and October, you'll need to fill out a survey to report your own performance, to kind of just show that you are actually looking at your data. That will get pushed out to anyone who has an account and is eligible in May. So there's nothing you can do about that now. You don't need to look for it. It doesn't exist yet. We'll send that to you. And then the number 3 is that you have to actually meet one of the 2 performance targets. So we will take either, but you do need to be meeting the collaborative-wide target for adult or pediatric head injury to qualify for that. So 3-step process: get an account, fill out the survey in the second half of the year, May through October, and then actually meet one of the 2 performance targets. Okay. And then the other part of the VBR, the kind of the normal collaborative-wide VBR, we got that as well. This was very closely aligned with the P4P targets that I just talked about. It's a slightly different group of hospitals, so the numbers are a little bit different, but it's exciting to see that we, again, with adult head injury, really kind of crushed it past. We got ourselves under the mark for pediatric head injury. So all eligible medic physicians will qualify for the 3% fee schedule increase, which actually started Tuesday. So your claims should start getting paid on that Tuesday. Okay, and then just similarly to what I showed for P4P, here's the monthly. We were pretty consistent. A nice little increase in adult head injury. It was a little more bumpy in pediatric head injury, but we did make it into the mark. Okay, so that is the update on how P4P and VBR went in 2021. The 2022 information is available on our website. I emailed everyone, and please reach out if you need a refresher on what that information was. I'm happy to send that. I did want to touch back a little bit really quickly on a video and email that I sent out a few weeks ago, I guess at this point, in response to a call that we had with the abstractors back in late January. So there's been a little confusion about this, and so I wanted to just take a second to make sure that everyone understands the way the system works. So what we're trying to do is give you, being the abstractors, a little bit increased flexibility and hopefully reduce stress related to the deadlines of submitting your medic data, which when I say that, I mean completing the cases in MedicLink. So those are due every quarter now in 3-month bunches. This does not change when you have to actually upload the data. So we did a little kind of emailing back and forth within the coordinating center. I think that there's, when I say upload, what that means to me may not mean the same thing to everybody else. So it seemed like there was some confusion. We are not switching when your IT people put your cases onto the SFTP server to get into MedicLink, nothing has changed on that. So you'll still get cases into your queue once a month. But you don't have to get those completed when I say completed, finished in MedicLink until the end of each of these 3-month deadlines. So I apologize for the confusion on that. I know some people were scrambling to try to change their IT structure. That was definitely not what we were trying to do. The point was to hopefully, if you want to keep doing your cases every month and that works for you, you should be able to do that, no problem at all. But just give a little bit of flexibility so you can take some vacations or deal with the seasonality of case surges a little bit better too. So I think there'll probably still be questions. Please, email me, email Katie Carey, whoever, just let me know. I'll be happy to try to answer those questions for you. Okay. And one other update we do have for everyone is, one of the questions was around the actual funding for abstractors from Blue Cross. We've heard a lot of concerns about inability to hire, recruit, or retain abstractors in the current job market. We really want to try to support that, and Blue Cross has agreed to increase funding for abstractors in the 2022 year. So the 2022 claim rate changes take place in July. when that shows up at your hospital, it gets a little complicated with fiscal years, but we will be submitting new case volume rates in the next month or two, and those go into effect from the Blue Cross perspective in July. And we are excited to say that between increasing the amount of the salary amount and the amount percentage of that salary that Blue Cross is paying, that abstractor funding is going to increase by 16% in 2022 when these new claim rates take effect. So hopefully that will help, it's two separate things, but we'll get you the increased FTEs if necessary to match your case volumes. And hopefully this increased funding that goes to the hospitals will help retain, attract abstractors to do this work.